In September 2009, Typhoon Ketsana and 3 other typhoons hit the Philippines and caused massive flooding in northern Luzon and Metro Manila. This unexpected and sudden natural disaster led to lives lost and damage to property, infrastructure, and livelihood. Rivers and lakes overflowed, floodplains were completely submerged for months, and mountains collapsed, causing landslides and mudslides. There was rapid, unprecedented outpouring of assistance from the international community as well as from the Philippines. And Impact Philippines was very fortunate to be involved in the disaster relief efforts with the assistance from our Impact family. We plan to reach out to the affected villages where we had projects in the past so we could link with the local health workers to distribute relief. We are very lucky to connect with eager and willing private corporations and organizations with a capacity for distribution, greatly expanding our Impact volunteers. The reality was that there was no electricity, no tap water, no way to get around, nothing to cook or cook with, no shelter, no dry clothing, and no means of work. Everything was covered in mud, immersed in or swept away by water, boulders, and silt, and there weren't enough evacuation centers to seek refuge in. So, we prepared family disaster packs good for a family of 6 for at least 5 days. The pack contained 2 kilos of rice, bottled water, canned goods, ready-to-eat food for young children, all fortified with vitamin A and iron, a hygiene pack with bath and laundry soap, mats and blankets, medicines for fever and diarrhea, vitamin C, and candles and matches. These family disaster packs were distributed by our partner Impact volunteers directly to the communities. The distribution process involved climbing mountains for 8 hours and even riding small outrigger boats lakeside. Our partners also made house-to-house and even roadside distributions anywhere with a dry patch of land. We targeted areas that were not easy to reach and those who were not served by the bigger relief efforts. Our approach was using the local volunteers, flood victims themselves, to help us help them. Our system involved the use of colored coupons to redeem the packs, small distribution venues, and village volunteers. This was necessary to avoid stampedes and long lines for better crowd control. For the recovery phase, we prepared assorted medicines for children for diseases that usually come with exposure and lack of adequate food and shelter. 1 box was packed good for 100 children, and a number of boxes were distributed to the doctors manning the far-flung local health clinics. We organized and funded a series of medical camps for children with the help of local volunteer doctors. We also distributed flour good for a 2-week supply of daily bread for free to the 10 school bakeries that were Impact funded in both Marikina and Muntinlupa City, lakeside communities that were flooded for more than a month. This was to make sure that the school children had a nutritious source of food just for themselves, aside from the shared food from the family pot. We learned that we can mobilize an army of Impact volunteers when the need arises in the areas where disasters strike when they have a system to follow. We also learned that we can team up with other entities, whether they be government or the private sector, as long as we are clear on what each of us contributes to the whole effort. Cooperation, collaboration. Together, we can make a difference.